acute lymphadenitis. The story of acute infection in the lymph node is septic focus. And from this septic focus, microorganisms pass in the lymph vessels to the draining lymph nodes, leading to acute inflammation in the draining lymph nodes. What is the complications of acute lymphadenitis? Infection in the lymph vessels, which is called lymphangitis. And from the lymph vessels, infection may pass to other lymph nodes, leading to more and more lymphadenitis. And the infection to the surrounding structure, skin and subcutaneous tissue. Therefore, the first complication is spread of infection, leading to lymphangitis, other groups of lymph nodes leading to more and more lymphadenitis, and surrounding structure. If the condition is neglected, suppuration and acute abscess formation occur in this lymph node. What is the clinical picture of acute lymphadenitis? It is acute inflammation. Therefore, there is fever, headache, anorexia, malaise. And the most important is feature of the cause, manifestation of the cause, like manifestation of pharyngitis or tonsillitis, leading to acute lymphadenitis in the submandibular or upper deep cervical lymph nodes, or infected wound in the hand, leading to acute lymphadenitis of axillary lymph nodes. Therefore, usually manifestation of the cause is very prominent. Or very famous story is acute mastitis, followed by acute lymphadenitis in the axillary lymph nodes. Therefore, manifestation of the cause, in addition to other manifestations of acute inflammation, manifestations of toxemia like fever, headache, anorexia, malaise. Locally, the affected lymph node is enlarged, mobile, firm in early cases. But if suppuration occurs, fluctuation occurs. The lymph nodes is painful and tender. The overlying skin is red and warm. And there may be redness and tenderness and streaks passing here from the septic focus to the inflamed lymph nodes. What are these red tender streaks between the septic focus and the lymph node? These are the inflamed lymph vessels, which is lymphangitis. In neglected cases, manifestation of suppuration occur, as we said before, in acute abscess. What is the treatment of acute lymphadenitis? Sure treatment of the cause, and treatment of the cause and acute lymphadenitis is antibiotic and local heat. If suppuration occurs, sure as any abscess, the treatment is incision and drainage. Acute lymphadenitis is one of the causes of enlargement of lymph nodes, and Acute lymphadenitis usually acute non-specific lymphadenitis, which means any organism, staph, strep, pneumonia, pneumococci, any organism may produce this acute non-specific inflammation. If the condition is not treated properly, the condition may pass to chronic non-specific lymphadenitis, which is chronic inflammation in the lymph node. The causative organism, any organism, staph, streptococci, pneumococci, gonococci, chronic, non-specific. This condition is very, very, very common, but unimportant clinically because the cause is usually present in all population. What is the cause? Chronic non-specific lymphadenitis usually affects the superficial inguinal lymph nodes. Why? Bad habit. Bad habit, which is walking barefoot. Sorry. And due to walking barefoot, abrasions in the foot, which is the way for introduction of microorganisms which pass in the lymph vessels and to the superficial inguinal lymph nodes, or it is very common in the cervical region. Why? Septic tooth, chronic tonsillitis, chronic sinusitis, and the infection pass from this septic focus to cervical lymph nodes producing chronic non-specific lymphadenitis. And the clinical picture is usually manifestation of the cause, plus the lymph nodes are usually small, less than 1 centimeter. And you should put on your mind that any lymph node less than 1 centimeter in size is stationary, not enlarged, fair, discrete, mobile. This is usually chronic non-specific lymphadenitis, which is not important clinically. The most important is less than 1 centimeter is stationary, not enlarged, not hard, not fixed. Because if more than 1 centimeter, progressively enlarged, hard, fixed, this suggests malignant lymph nodes. The treatment of chronic non-specific lymphadenitis is treatment of the cause. There is chronic lymphadenitis, but may be specific. Chronic lymphadenitis may be specific, like TB lymphadenitis, as we said in the previous videos. And there is very, very rare condition nowadays all over the world, which is syphilis. Syphilis is usually eradicated in most parts of the world. If syphilitic lymphadenitis occur, syphilis is divided into 3 stages. Primary syphilis, which is usually presenting by genital ulcer, called chancre. Genital ulcer or chancre, or the chancre may affect the lips or the tongue, leading to enlargement of the inguinal or cervical lymph nodes. The lymph nodes on both sides are enlarged, firm, mobile, discrete, not tender. Primary stage of syphilis produce localized lymph node enlargement. If genital ulcer leading to inguinal lymph node enlargement only. If in the tongue or lip, it affects cervical lymph node only. But after many years, secondary stage, and the organism pass all over the body, reaching all lymph nodes all over the body, leading to generalized lymphadenopathy, and usually affect the epitrochlear and cervical lymph nodes in addition to other lymph nodes all over the body. Tertiary syphilis. Tertiary syphilis is actually complication of gamma. Gamma necrotic material occur in bones, occur in muscle, in any structure, and necrosis, which is gamma, leading to secondary infection, and secondary infection leading to lymphadenitis. Therefore, tertiary syphilis usually acute septic lymphadenitis due to infection of gamma. And they never put in your mind that the enlarged lymph node is gamma in the lymph node. Gamma in lymph node is extremely rare and not present. One of the most important causes of lymph node enlargement is malignant lymph node enlargement. Malignant lymph nodes enlargement, three causes. In the previous videos, we explain lymphomas. And in medicine, you should study leukemia. And very important in surgery is metastatic lymph node enlargement. Metastases in the lymph node. We all know that metastases in lymph node coming from carcinoma or sarcoma. Sure, from carcinoma. Sarcoma is famous in blood spread, not lymphatic. But there is exceptional one sarcoma famous with lymphatic spread. Sarcoma in bone called the Ewing sarcoma. And also malignant melanoma. Therefore, metastases in lymph nodes usually from any carcinoma all over the body, malignant melanoma, or Ewing sarcoma. What is the clinical picture? The clinical picture, early. Early, there is hard, painless, not tender, discrete, mobile lymph nodes, progressively enlarge, and early the lymph nodes are discrete, but in advanced cases the lymph nodes becomes matted together, and due to infiltration of surrounding structure the lymph nodes becomes painful. Sure, if you find lymph nodes with this character, you should examine the patient for the cause, which is the primary tumor. Example, if there is enlargement of cervical lymph nodes, examine the tongue, the oral cavity, examine the thyroid. Usually manifestation of the cause is present, except there are certain sites famous with hidden carcinoma, presenting by metastases in the lymph nodes with occult primary, like carcinoma in the hypopharynx, malignancy in the middle ear, malignancy in the nasal sinuses, bronchogenic carcinoma, stomach, especially fundus of the stomach, and testes. These are famous hidden malignant, may present by lymph node enlargement as the first presentation, metastases in the lymph nodes. What is the treatment of metastases in the lymph nodes? As any tumor. In early cases, which is operable cases, excision of the primary tumor with the draining lymph nodes and the tissues in between. If this is malignancy and this is an enlarged lymph node, you should examine the primary tumor and the lymph node metastases and the tissues in between. Why? To excise the lymph vessels which containing malignant cells, and these lymph vessels, if left, recurrence occur. In advanced cases, sure as any malignancy, palliative chemotherapy and radiotherapy. Finally, lymphadenopathy. What is the meaning of lymphadenopathy? Lymphadenopathy means any lymph node enlargement due to any disease. We should notice that normal lymph nodes cannot be seen, cannot be felt. And any lymph node less than half to 1 centimeter and the station does not enlarge is clinically insignificant. What are the causes of lymph node enlargement? We should divide the causes of lymphadenopathy into localized lymphadenopathy and generalized lymphadenopathy. Localized lymphadenopathy means enlargement of lymph nodes in one anatomical region. Generalized lymphadenopathy means enlargement of lymph nodes in more than one anatomical region. Localized lymphadenopathy or generalized lymphadenopathy can be divided into inflammatory and neoplastic. Localized lymphadenopathy may be inflammatory, as we said now in this video, acute lymphadenitis, which usually non-specific lymphadenitis or specific. Acute specific lymphadenitis as a disease called infectious mononucleosis. Chronic lymphadenitis may be chronic non-specific or chronic specific lymphadenitis. And we said before that chronic specific lymphadenitis like TB and primary and tertiary stages of syphilis, which is very rare. Localized TB lymphadenitis in lymph-borne type only, because blood-borne type is famous with generalized lymphadenopathy. These are the inflammatory causes. What are the malignant causes? Early lymphoma and the early metastases. Generalized lymphadenopathy may be inflammatory or malignant or autoimmune disease. Generalized lymphadenopathy may be blood-borne TB, secondary stage of syphilis, or any fever or any infection. This infection or fever leading to reticuloendothelial hyperplasia and generalized lymph node enlargement. Generalized lymphadenopathy may be malignant. Malignant, the famous malignant cause for generalized lymphadenopathy from the start is leukemia. But generalized lymphadenopathy may also occur in advanced lymphoma, or metastases. Generalized lymphadenopathy may occur due to autoimmune or collagen disease, as in medicine. These are the causes of lymph node enlargement and the famous causes of lymph node enlargement. Thank you for good listening and good luck.